Good afternoon, everyone. My name is Chelsea Karaoke. I am a technical project manager working with IntelliSoft Consulting Limited, and I'll be making the presentation on behalf of Dr. Rose. She hasn't been able to join us today, but hopefully she'll come during the remainder of the session. Okay, so I'll be taking you through our transformation of the immunization services in Kenya, just to give you a description of our experiences. So I'll take you through the background of our immunization program, then probably show you how we've digitalized some of our immunization services, and from there, maybe we can take a few questions. So for Kenya, the Ministry of Health has been working in collaboration with a couple of partners, including CDC and WHO, and we have been able to make notable progress in combating this vaccine-preventable diseases. One of the ongoing campaign sessions that we've been having in Kenya is the ongoing polio response, where we've vaccinated nearly 9 million children under 15 years old. We've also had a measles rubella vaccination campaign where we targeted over 3 million children. So despite having all this notable progresses and successes, we've had a couple of challenges that have impacted our routine immunization program. That included the COVID-19 pandemic. But during that session, we had a couple of technologies that were developed so that we can be able to at least digitalize some of these services and make accessing these healthcare services easier. And from there, we were able to develop a system called Chanjo KE. So Chanjo KE is a system that we used to track the vaccinations for the COVID-19 vaccine. And due to the success that we observed using that system, we were able to come up together and say, let us digitalize our routine and non-routine vaccinations. So from there, we developed an electronic immunization registry called Open Chanjo, which was built, or rather leveraged, the Open Health Stack. So we were able to scale from just the COVID-19 vaccinations and cover all routine and non-routine vaccinations for children under 5 years as well as above 5 years. So we had a couple of stakeholders who we engaged with as we were developing these systems, one of them being the Ministry of Health, National Vaccines and Immunization Program, as well as public health experts, health informatics specialists, and our software developers who are able to provide guidance on some of the technologies that we should be able to use. During these stakeholder engagements, we had an initial meeting with the National Vaccines and Immunization Program, where we were able to identify the challenges that they are facing. We were able to streamline their workflows and align our system goals as well as the ministry's objectives. Other than that, we were able to gather the functional requirements, and we were able to have a discussion on integrating the Open Chanjo system with existing ministry systems so that we can be able to enable seamless health data sharing. We had frequent progress review meetings where we ensured that the work that we were doing during the development aligned with the workflows that we had discussed before we went ahead and did a field test and piloted the system. So we were able to note some of the challenges that they are facing in the immunization program, and some of them included having fragmented and paper-based record systems. They were also struggling to identify zero-dose children. There was limited real-time visibility in the immunization coverage, as well as barriers to accessing and utilizing the immunization data. So using all that information that we gathered during the requirements gathering process, there are several digital health interventions that the Ministry of Health has been able to use so that we can just digitalize our immunization program. The first one, as I had mentioned, we had Chanjo KE, which was the system that was developed during the pandemic so that we can be able to manage the administration of COVID-19 immunizations. The second one is Open Chanjo, as I have mentioned, which is an electronic immunization registry that we developed to manage both routine and non-routine immunizations at scale. We also have Chanjo ELMIS being used by the Ministry of Health, which has been used to manage which they have been using for stock management and logistics and supply chain all across the country, as well as KHIS, which they are using as a system for indicator reporting. So majority of you may know KHIS as DHIS, so DHIS2. So we have KHIS as our localized version, basically. These are some of the paper-based systems that we were using during our immunization process. So we have the mother-child handbook, we have the yellow fever booklet. I'm sure you have interacted with a couple of these recording tools. And Open Chanjo, as we have mentioned, is the electronic immunization registry that we've developed. And it provides a digital solution to safeguard the health for all Kenyans against vaccine preventable diseases. So as we developed Open Chanjo, we leveraged the SMART guidelines and localized it to the Kenyan context. So on the first layer, as we have the narrative guidelines, we have our Kenya National Immunization Policy guidelines. From there, we were able to develop a DAC after gathering some of the user requirements and system requirements. So our DAC is the Kenya Immunization Digital Adaptation Kit. And we were able to transform them into machine-readable recommendations, which is our Kenya Immunization Fire implementation guides. And we were able to develop our reference software, which is the Open Chanjo system. Since we have leveraged on the Open Health Stack, we're able to have our data. Since it's already standardized, we have clean data, and we can be able to use our data for the analysis that will be used for developing an AI model, so that we can be able to at least have a precision health model. At the moment, Kenya's Ministry of Health is currently focused on having most of our systems on the Kenya Digital Superhighway. And we have a couple of systems that we have on the point of care that are able to interact with all the other systems. As I have mentioned, we have Open Chanjo and our point of care systems, as well as Chanjo KE. The system should be able to communicate with a couple of other systems within the digital health superhighway, including the client registry, so that we can be able to have at least unique client identification. We can also be able to link to the shared health records, as well as the Chanjo ELMIS, as I have mentioned, for logistics and supply chain. So we piloted the Open Chanjo system, as I had mentioned. And we have been able to cover 4 counties at the moment with 11 facilities, and we have received positive feedback due to from the pilot exercise, and we've had clients come in and say that at least even as they forget their mother-child booklets, or maybe some of them have lost it, it has been able to make the immunization process for them easier. So we are looking to have the Open Chanjo system deployed nationwide, so that we can be able to access this system across all facilities, and we can support Kenya in terms of having a Kenya free from vaccine preventable diseases. Thank you. I don't know whether there are any questions.
One at the back. Thank you.
So, good day for everyone. Karen Salinas. I'm part of the DIPC project from GIZ, so Digital Innovation for Pandemic Control for the German International Cooperation. So, congratulations for the software. And I have some kind of questions. So first is regarding the connectivity. I don't know how you to manage in the village or places where there is not connectivity, how you are using the Chanjo. the device that you provide, because I think you showed that they are using a smartphone. So I would like to know if the smartphone are from the people that are going there to in the vaccine campaigns, or the Ministry of Health is providing the device with the data that they need in case for the registration. And have you used a geo-reference for this application? That is geo-reference, like they can see, you know, where are like the population that is the target, and they can actually in the Shanjo try to localize, so who are in the plan to vaccinate. And okay, that is, and because, sorry if I didn't listen proper, but you have that as a pilot, so the population that you reach in the pilot, could you say to us? Thank you.
Okay, maybe to answer that before we move to another question. In terms of areas with no internet connectivity, as we had mentioned, we have leveraged the Open Health Stack during the development of Open Chanjo, and one of the key components that are being used in the Open Health Stack is the Android Fire SDK. So we have a mobile version of the Open Chanjo system, and people can be able to access the system without internet connectivity. So no internet, no worries. But once you're able to get to a place with internet connectivity, you can sync your data and have it all backed up. Regarding the numbers, before the question that you, to answer this question before that one, because for the second question, I might need a bit more clarity. For the numbers that we have in the system, we did a pilot in 4 counties, that is Nakuru, Nyeri, Makueni, as well as Nairobi. We've covered 11 facilities, and we currently have approximately 70 healthcare providers using the system, as well as approximately 1,800 children already registered in the system, and their records are currently actively being updated even as they are receiving their immunizations. For the second question, could you please repeat it? I'm not so sure whether I was able to get it right.
Okay. Yeah, you know, like in Peru, the problem is they not the people who are working in the healthcare system, they don't want to use their own smartphones. So it's the Ministry of Health who have to provide the smartphone with internet to use it or not, how you made it. And sorry, are you using like a cloud or physical servers?
Okay, so at the moment, the people at the facility, there are some facilities that had devices, that is tablets, computers, the desktops, and they were able to access the system using the web application. Some facilities had internet connectivity, others did not. For those facilities that did not, we provided internet, rather data bundles for them to use during the pilot exercise. There were a few facilities where the healthcare providers were actually using their own mobile devices. Yes. Regarding future deployment, I think for that, I can probably not answer that question at the moment. Yeah.
From Perth, I work with Chelsea. I think you asked whether we're using cloud or a physical server. So for the field test, the Ministry of Health provided us with a, let me call it a sovereign cloud, and a domain that is health.go.k. So that's what we're using when we hope to keep using whatever the government provides us. Yes.
Oh, great. So my name is Leanjeri. I am with Safaricom. Just my question is, as the digitization process is rolling out for UHC, have you maybe had a convergence with the developers of the HMI system so that you can see how maybe the Chanjo module, the Chanjo system, the open Chanjo system will sit into the MCH module so that they don't have to have double entries or things like those? I don't know whether that has been talked about. And good job with what you're doing with the Open Chanjo and ELMIS.
Thank you so much. I think I'll let my colleague Margaret answer before we proceed.
The HMISs are in progress, I think, as you know. So most of them have the CWC module as part of the maternal child health care module. So what in Kenya we call the child welfare clinics, which is what ideally should collect all immunization data. But those are not rolled out as far as we know. So what we're doing with Open Chanjo is to keep collecting data as we go. We're not going to have paper as we wait. Whenever the HMISs are ready, they'll find Open Chanjo. The beauty is Open Chanjo is fire compliant, so meaning it can be interoperable with Kenya EMR, with AFIA-K, with any other system, and through the HIE. So just to say, we've already done in our sandbox that mimicking of how that would work, and it works well. Thanks.